I want to tell you about something that was published recently in Mayo Clinic Proceedings. This is 2016 July, so hot off the press. And this is from the International Expert Consensus Conference regarding testosterone therapy in men. And what this was designed to do was put away a lot of misinformation. What happens is that doctors will get some new medication on the market, and sometimes they're not sure, should we use it or not, what's the proper treatment for hypertension, diabetes. And when a good example is hypertension, high blood pressure, is that there was different treatment options and people kind of going on their own and figuring out what level do you treat blood pressure, what medicines are best, what's first line and second line. Then international consensus will get together to put together expert panel from all different specialties, and they'll look at the literature and decide unanimously what is the most appropriate steps to take, okay? And they did that with testosterone replacement for men. So they took specialists from multiple continents, multiple countries, multiple fields. They looked at the available medical literature that was historically available, and they tried to determine, is there, are there risks with testosterone therapy, who is the best candidate for it, what kind of blood tests you need to do. And they wrote up their consensus guidelines, and I kind of wrote them out here in a little brochure made for patients. I'm going to go over them, okay? And I'm asking myself, are we really telling men that, we should be screening them? Okay, summary of the resolution. Number one, testosterone deficiency is a well-established, significant medical condition which negatively affects male sexuality, reproduction, general health, and quality of life. Now, most men who are low on testosterone really aren't worried about reproduction, but certainly general health and quality of life. And they went on to say low testosterone predicts increased risk of obesity or metabolic syndrome, an increased rate of cardiovascular events, poor quality of general health. So again, low testosterone is an increased risk of obesity, metabolic syndrome, increased rate of cardiovascular events and death, and is associated with lower quality of life and poor general health. So low testosterone, more death, more heart attacks, more obesity, more metabolic syndrome. Should we be screening, guys? Yes, obviously. The symptoms of testosterone deficiency, this is number two, the symptoms of testosterone deficiency occur as a result of low testosterone and may benefit from treatment regardless of whether there is an identified underlying etiology. And too often in healthcare, doctors are trying to figure out, why is your testosterone low? It just gets low as guys get older, and you don't have to search for a cause. Low testosterone should be treated just like diabetes should be treated or any other condition. Testosterone deficiency is a global health problem. In the US alone, it's estimated in the next 20 years, we will spend $525 billion on diseases that could have been prevented with testosterone replacement. Now, you think healthcare treatment is expensive now. How about you have an inexpensive solution to reduce the risk of obesity, metabolic syndrome, poor general health, and cardiovascular disease versus let it go. So when somebody gets cardiovascular disease, now it gets really expensive. And this, like I say, is $500 billion over the next 20 years that is preventable. And this is what they estimate can be reduced. Testosterone therapy for men with testosterone deficiency is an effective, rationale, evidence-based. Okay, so just like testosterone works. Number five, there is no testosterone concentration threshold that reliably distinguishes those who respond to treatment and those who will not. So what I hear is, patients have low testosterone levels and they're not saying, well, it's not low enough. There's a range of, let's say, 300 to 1100, and the guys at 300 are symptomatic. Well, you should be treating them, obviously. But there tends to be like a bias for doctors who want to treat people only at the worst bottom 1 percentile, and that's nonsense. This is a global health problem. Increased risk of obesity, metabolic syndrome, cardiovascular disease, and death. We don't have to be so aggressive about waiting. Guys are really, really sick. Okay. Number six, there is no scientific basis for any age-specific recommendations against the use of testosterone therapy in men. Period. Again, there is no scientific basis for any age-specific recommendations against the use of testosterone therapy in men. So regardless of age, men respond to testosterone therapy if they are deficient. So if a guy's young or old and their testosterone is low and they have symptoms, they will respond, and there's no scientific reason not to treat them. So if a guy's 75 years old, you're gonna say, well, he's too old. Well, yeah, but it's not like if a guy is like 75 and he's got low thyroid, we're not gonna treat him. In fact, they specifically said in their paper, avoiding testosterone replacement in the elderly men is as illogical as avoiding the treatment of other conditions such as high blood pressure, heart disease, arthritis, and cancer because they occur more frequently as men age. And this has been an enormous bias in healthcare. It's kind of like a ridiculously enormous bias. The bias is that men's testosterone declines as they age. Therefore, it's just normal. Well, okay, then they get more metabolic syndrome, they get more obesity, they get more cardiovascular events, and they get more death. Okay, so we're saying, as healthcare professionals, well, it's just normal to age, your testosterone gets low. Okay, then why don't we stop treating metabolic syndrome and heart disease because it's a normal course of age? And that would be, we think that's ridiculous. Okay, and the International Consensus Panel said this is ridiculous. Okay, stop saying that. It's too often that family doctors and interns are telling men, you know what, just age normally. Age normally means like some bad shit. Okay, I'm sorry, it means some bad stuff. This is number 7. The evidence does not support the increased risk of cardiovascular events with testosterone therapy. Now, recently in the literature, there were some flawed studies that suggested that perhaps testosterone therapy led to more cardiovascular events. They were flawed. One was retracted, and the other one was proven to be wrong. Yet there's been over 24 studies showing that testosterone therapy reduces cardiovascular events. And doctors will use that as a reason not to prescribe. Well, you've got heart disease, so we shouldn't treat you with testosterone. Actually, it reduces your chances of events. Okay, so there is no reason to be concerned about cardiovascular events with testosterone therapy. And a lot of doctors cite that because there was always a bias. The bias started out that since men have more testosterone than women, and men get more heart attacks than women, it must be the testosterone causing the heart attacks, and that couldn't be further from the truth. The men with the lowest testosterone had the most heart attacks, and men with normal testosterone had the least. Number 8, the evidence does not support increased risk of prostate cancer with testosterone therapy. And that's, again, a big bias. We're afraid that since testosterone is present in men get prostate cancer, that it's linked. There's no evidence to support that testosterone replacement increases a man's risk of prostate cancer. So those are international consensus guidelines. And what I want to do is realize that when we have some information in our hands that's clear and obvious, supported by international consensus, expert recommendations, and we're the ones that can screen men. We have the ability to screen men for low testosterone and treat them. Okay, we have a very simple, straightforward treatment that we should be offering to our patients. So we're going to start screening men and women for hormone deficiency. A lot of doctors are afraid of hormone replacement therapy. We're not. And we have the ability to offer that to our patients. Thank you very much.